Hey, welcome. My name is Rachel Smith, and this is the Natural Health Rising podcast. I am a certified functional diagnostic nutrition practitioner and the owner of Natural Health Rising, which is my online holistic functional medicine company where I help people who have autoimmune diseases, chronic illnesses, mystery symptoms, and a whole host of other imbalances restore their health by natural means. On this podcast, you're going to hear conversations between myself and other health experts on functional medicine and general holistic health. My goal is to provide you with the tools you need in order to help you rise to your healthiest and happiest self. So in this episode of the Natural Health Rising podcast, I have Dr. Paul O'Malley with me. So Dr. O'Malley holds a master's of Biomimetic Dentistry. He's an innovator in his field towards the direction of rebuilding teeth to its native state. His practice uses materials that share the strength and function of our own natural teeth. Dr. O'Malley confronts the corrupt common practices of his industry and finds that dental standards do more harm than good for their patients. The goal is to share this news widely and make known the dangers of harmful dentistry practice, which have sadly become all too common. Welcome to the show, Dr. O'Malley.
Hi, Rachel. Thanks for having me on. It's great to be on the program.
Yeah, I can't wait to talk all about dentistry because this is a topic, like I was telling you before, we haven't really dove too far into yet. So I'm sure this will be super enlightening for all of the listeners. So why don't you start by telling us a little bit more about what actually is biomimetic dentistry and how would that be a little bit different from maybe biological or holistic dentistry as well?
Sure. Well, anytime they use the word bio, it means life. So biomimetic just means trying to copy or mimic Mother Nature. So when it comes to dentistry, we have all the engineering understanding of how the structure of a tooth functions. So it's basically if a tooth gets tooth decay, breaks down, et cetera, how do we rebuild it in a way that mimics Mother Nature? And that's where biomimetic comes from. I didn't coin the term. It's an interesting term. But it does throw people for a loop sometimes because it gets confused with biological dentistry because it has the word bio in it.
Mm-hmm. Can you explain the difference with biological? Because I think some people don't really know what that is, in fact.
Sure. So, and biologic dentistry is also another name for holistic dentistry. So we're working with materials that are more well adapted to the total body system. So in other words, if a person has a bunch of the toxic mercury fillings in their mouth, etc., how do they remove them safely without harming their own body? How does the doctor and his staff remove it safely without harming themselves? And then further, what material are they going to place back in there? Because the material they place back in, while it will never be as bad as the mercury that leaks out into the body, it still can have its own systemic trouble. So a biologic dentist is savvy with that whole concept, and it's sort of just another name for holistic dentistry.
Mm-hmm. Okay, great. Well, so what are the dangers of standard dentistry practices then? Why do we want to avoid this, or what's going on there?
Well, just like we're seeing the movement in mainstream medicine to try to be more inclusive of the total body system, dentistry is a specialized form of medicine. It's basically going in and we fix things that are broken down in the mouth. If we see infection, we clean it up, we handle it, we restore it as best we can back to its original form or to some type of functional form. But we don't take any regard generally. I wouldn't say that we don't do it at all, but as a traditional dentist, traditional dentistry will look at what's going on in the body, but they don't see the oral cavity body connection per se, like a holistic or a biologic dentist would. Mm-hmm. And some of the trappings of that is that the traditional dentist is going to be basically fixing teeth in a way that they're just fixing things, but they're not really looking at how did this fully come about? What can we do to improve it? What's your diet like? What's going on there? And then also the materials that we use. Are these as safe as we know they can be for your particular body and your body type. That's not happening in traditional dentistry. Also, traditional dentistry for about 150 years has done what we call crowns. That's where you reduce 75 to 80% of the enamel on a tooth, and you stick this cover over the tooth. And it does restore the function, but it's such a great amount of destruction on the tooth. You would think in 150 years there's a better alternative. And there is, and they're beginning to teach it a little bit in the dental schools, but it's very slow to come about. And so sadly, the majority of people that I see, or the majority of people out in society, if they're 40 years and older, they have several crowns on their teeth. And on my website, I go into that. I go into the challenges and dangers of that and why it shouldn't be happening. So dentistry served this great function, and it's a great group of people. I mean, they really are trying hard to eradicate dental disease and health, but the tools they've had need to be upgraded to be minimally invasive and to also be inclusive of how is things that we do in the mouth going to affect the body and vice versa.
Mm-hmm. Yeah. So I know I've read a lot about how autoimmunity, cardiovascular disease, other inflammatory based diseases have a really strong connection with oral health. Is there anything else you can add to that or speak on that a little bit?
Well, for example, for your people that are watching the podcast and the listeners, there's a big connection between cardiovascular illness, that's heart attack, stroke, blood clotting, etc. If a person has gum disease, for example, the American Heart Association recognizes that. And so it appears that the inflammation that goes on in the mouth can leak into the body, into the bloodstream, etc. And it can cause lesions, which are little sores along the cardiovascular highway. And if it does, the body comes in and repairs it. But if it repairs it too much with its cholesterol and things like that, we can get a thickening of the area, which can lead to a clot, or some call it a stroke or heart attack. And there's definitely a correlation. So it's really important that people don't have infection in their mouth. That's one thing. The other thing is if they have mercury in their mouth, mercury fillings called silver fillings, really they should be called mercury fillings because it's 50 to 53% mercury when it's placed in the mouth. And it comes out very slowly. So some people think, well, I've had mine for 35 years. I'm sure it's all out now. Why get them out? Well, it looks as though even after 180 years, they're still loaded with mercury. So there's tests that can be done and things like that, but we know the mercury's still there. So we want to make sure that we're doing things safely in the mouth, that we're doing things in a way that is not causing further trauma in people's mouths. And when we go in and we remove mercury, we want to do that safely. So there's a lot of aspects in more advanced dentistry, and people have to just search and find out who does more of these types of things, because the traditional dentist is geared for just drilling and filling and fixing, and they've been taught dental. They understand dentistry, they understand the structures of the tooth, etc. But they basically use whatever the best manufacturing company out there is that pushes their products to restore the teeth. And they're looking to fix things fast. Mm-hmm. And the problem is with biomimetic dentistry, it's not really a problem, but it takes time because you're building teeth in layers, just like you would build a brick wall, brick by brick. You have to do it properly. Then if the wall breaks down, you only have to replace one brick. You don't have to replace the whole wall. In mainstream dentistry, they're filling a tooth with one big glob of material typically. And if that breaks down, it leaks underneath it, creates its own problem. So these are the things that have been evaluated and looked at, and extensive scientific literature and studies have been done on what materials mimic Mother Nature, the flexation of the underlying structure of the tooth, which is called dentin, or the hardness of enamel. What materials do we have that mimics that? And we now know those things. In traditional dentistry, again, as I say, we were just grinding the tooth down to a little nub and sticking something over it, which traumatizes the nerve of the tooth. And then we end up getting into a whole nother a gray area. A person needs a root canal or not a root canal. And that all has so much information floating around on the internet. It's a hard one for people to come to a decision about.
Mm-hmm. What's your opinion on root canals?
Well, I pretty much follow the IAOMT, which is the International Academy of Oral Medicine and Toxicology. Anybody listening can go to the IAOMT.org and see their position on it. And theirs is based on scientific literature, show me the science, etc. And at this point in time, we don't recommend everybody run out and get their root canal teeth pulled out because then you have to replace things, and the replacement may be more traumatic, etc. So you have to observe the patient in front of you. Are they doing well, or do they have weird, mysterious illnesses that are not clearing up? Could it be coming from some old leaking root canals? And now we can do 3D CT scanning, so we can actually see a little bit more closely if there's toxins leaking out. It'll show damage to the surrounding bone. However, on a microscopic level, we can't really tell, we can't see. There used to be a company that you could do a test along the side of the tooth to see if it was leaking out any toxic bacteria. Sadly, that company has gone under. They're not around anymore. So we don't have a really good test. So my rule of thumb is, in my opinion is, I look at each patient, and so would a biologic dentist and a holistic dentist typically would look at each patient and help them come to a decision that seems to make sense for them. Because the sad part is, on occasion, some people go out and get all their root canal teeth removed. Now they don't function as well, and they're still sick. Well, we don't want that to happen either. So it's basically, I'm more in the middle, I would say, of the road, where I'm a little bit more cautious. And if some people do need a root canal, I make sure and have them investigate what's called gentle wave root canals. It's a procedure that actually vacuums the small nerve out down in the root, so that instead of jamming bacteria and material down in there, they're pulling it out, and then they can disinfect the area. And that has and shows to have very promising results. Also, there's a laser by a company called Biolaser that you can place down in there, and laterally will hit the whole inside of the root and will disinfect the area. But I think if a practitioner had both of those tools and did a root canal, it looks promising that it won't build bacteria long term and cause systemic problems.
Right.
And by the way, that came about from a long time ago from Dr. Price in the early 1900s. He did a lot of research, the Price Foundation. He was a past president of the American Dental Association. He studied 13 different primitive tribes to see what's the best food source to eat. And he also did investigation on root canals. And he would take people that had kidney disease or liver disease or something. He'd pull a bad tooth, and he would stick the same tooth under the belly of a rabbit. Not very humane to the rabbit. However, it did prove out they got the same illness that the adult or the patient got. So there's some connection to those types of things. So there's a tooth body connection that we're still learning more and more of. But when it comes to root canals, I would say go to the IAOMT, read all about that, because it's a lot of great data. I mean, we don't have enough time to really cover all the information on this podcast, but it's very, very empowering to anybody that wants to learn.
Yeah, definitely. I think also another thing just to add from my perspective is, like, before running and ripping out teeth, is looking at your diet, your lifestyle, making sure you check all those boxes first. And then, you know, if you're not getting better from all those typical things we should change, then, okay, let's look at the teeth, let's look at the root canals, the mercury fillings, all of that kind of stuff. I
agree with you, Rachel. As a matter of fact, you'll see sometimes I'll have patients come in like this, et cetera, but they've got a mouthful of infection everywhere, and they're concerned about one root canal tooth. And it's so multifaceted. So it's like my whole approach is, let's get infection out, let's get things healthy. And if we can use nutritional things and programs like you have, there needs to be more of you out there. But, you know, because people need that guidance and help, because basically we wait for a symptom we go to the doctor, we get a pill, which has its own side effect. And the quality of life, there might be quantity of life, but the quality of life drops, as you've seen and as you know. And, for me, a lot of times I'll see people come in, like any practitioner out there, I would say, look, just look in your patient's mouth or have them look. Do they have mercury fillings? If they do, they should remove them safely, because it destroys our glutathione levels in the body, glutathione being the top antioxidant in the body. So that gets just sucked away. Now, that's a beautiful antioxidant to handle the body, keep it in balance, and one that's necessary perhaps in keeping the body from pulling in or manifesting cancers and things like that. So if the body's fighting gum disease or mercury fillings that are leaking out, and they all leak out, then it's depleting its natural resources. So some people are doing these things preventatively, and others, because now they're behind the eight ball, they have illness. When they have illness, it's a little harder to treat. But you may have seen it. I've had patients that have chronic fatigue. I recall one gentleman, we removed all of his mercury safely. This is over 20 years ago. He couldn't lift up a quart of milk. He had so much fatigue. And then he worked with a nutritional specialist like yourself, and someone that guided him on all the different steps with hair tests and blood tests and everything. And through the whole protocol, multifaceted, once we got the mercury removed, within 4 months, that's how long it takes the red blood cells to sort of regenerate and get healthy. He was basically 90% returned back to work, etc. And many of these kind of stories happen. And these are people that have been to the Mayo Clinic. They've been all around. It's like we've gotten so specialized in medicine and dentistry and these programs that we don't look at the whole body. And so someone comes in with chronic fatigue, and so basically they leave on an antidepressant. Well, that makes no sense.
Mm-hmm. Yeah, I have a personal story. I think I've shared this maybe once on the podcast before, but years ago, I was just like so tired, and I was getting weird numbness and weakness and tingling in my limbs. And I was like, okay, I don't know what's going on, because at that point I already worked on my lifestyle and nutrition. And I saw a functional medicine doctor, and he found very, very high mercury levels. I don't have metal amalgams, but I used to eat a lot of tuna and a ton of fish. I have tattoos. Like, there's a lot of environment, I've traveled a lot across the globe. So it was probably this culmination of all these things. And luckily I went through a whole bunch of detoxing and took care of it. But, and even if it's just from the fillings, like it can really have a huge impact, like you said, on fatigue, the nervous system, different organ systems. So I think it is really important for people to look into it, but then also to make sure that they're going through the IAOMT, or like someone who knows exactly how to safely take these things out, because it can be dangerous if it's done improperly.
Yes, you can release so many of the mercury toxins if you don't protect the patient. And sadly, the dentists are exposed to this so much in their daily career. And last I looked at this, I'd have to verify it, but it appears that dentists have 7 times more neurologic problems than the mainstream public. So yeah. Could that be just from bending over in their neck and all that kind of stuff? Could be, but they're breathing in this mercury stuff all the time if they're not wearing proper masks and doing proper protocols. So it should actually be in the dental schools. We've tried to put it in there, but keep in mind, the American Dental Association in the 1860s was founded by the group of dentists that ousted the gold dentists as being too rich and too expensive and greedy, and brought in this slurry black stuff called it was a mercury silver filling at the time. And they ousted that small group, and they formed a big group, and it became known as the American Dental Association. I mean, you can't make this stuff up. It's crazy. You talk about pull the line, pull the string. Well, why will the American Dental Association not denounce mercury fillings? Well, they were founded on mercury fillings. And now we've given them a simple out, like, let's clean up the environment. We don't need to have mercury in the practice. We don't, the school, someone dropped the thermometer at one of the grammar schools here in Southern California. It was in the news. The two of the adjacent schools, and that school was all shut down. They had the hazmat unit come in and get that little bead of mercury out of there. And they know that the toxicity and the dangers of it. And when I was a young kid, we would thermometer break, we would play with it. We didn't know, so we'd roll it around, because it rolls around, it stays bunched up in a little ball. It's quite interesting. They call it quicksilver because it slides around. So the American Dental Association was founded on it. We've tried to help them clean up their act by saying, look, it's not good for the environment. So we didn't even go on the political side of it's terrible for people. The IAOMT has a stack of papers, scientific papers, peer-reviewed papers that probably go up to the sky, showing how much comes out, where it goes in the body, where it accumulates. And by the way, for women, it's very, very rough. It tends to love going to the thyroid. And what do we see in women that go in their 40s and 50s around menopause? They see their thyroid is getting sluggish and wiped out. And now they have to get on thyroid medications, which has its own, it's a rough go for women, right? So they can have weight gain, they can have irritability, all kinds of situations that go on as a result. And somehow it just loves going to the thyroid. It goes to the kidneys and it goes to the brain. And when it goes in the brain, the body tries to take it out. It attaches to one of the neuron cells, the little format that forms the sheath of fat, let's say. It's linked together, atom or molecule to molecule. It inserts itself, and the thing breaks apart. So it looks like Alzheimer's patients. If you look at autopsies of people with mercury and autopsies of Alzheimer patients, they have these little tendril fibrils that pull back from the neurons, right? Well, when mercury goes in there, a little mercury molecule goes in there, the body goes in to take out the debris of the dead neuron, but it doesn't pull the mercury out. So the mercury now jumps to the next one. Then it jumps to the next. So it's cumulative damage. Very hard to get out. The best is to prevent it in the first place. And, the good news is, and too, there are programs to help people detox this stuff. So it's not a total disaster. And oh boy, if you have mercury fillings, there's nothing you can do. There is stuff you can do. You can have them removed safely and then detox before, during, and after to make the protocols not be harmful to your body.
Yeah. Is that something that your team helps people with when they go through getting their mercury fillings removed? Is there like a detox protocol for them?
I don't wear the hat, let's say, as the medical doctor doing that whole detox program. I have a couple little things that they can do, and namely glutathione supplementation and a few other things. But mine is mostly getting the source out. And then I have different people that I refer to, and they can go and detox all the way from very mild and light to IVs and things like that.
Yeah, the IVs are intense. I actually have done those.
They're too hard for a lot of people. So again, I have to look at the person and go, oh no, they're not going to tolerate that. Or some robust person, it's like they're probably fine, but
right.
Or I'd send them to someone like you. Why not?
I'll take them.
Yeah, there you go.
So we talked a little bit about how you'd for example, cardiovascular disease is correlated with mouth infections, dental diseases. So what should people be doing to prevent all of this from happening, and maybe on a daily basis for them to have clean, good dental care, but in a more natural or safe way?
Well, I have a company, it's not really fully a plug for my other company, but I will say that I've done a lot of research on oral care and oral care products. So I have all natural oral care products. The company's called Great Oral Health, Inc. And anybody can go to greatoralhealth.com and they can get a free booklet that downloads all of this information. It's free. Just sign up. So it's just greatoralhealth.com. But I will say this. One is you want to work with your dentist to make sure there's no infection in your mouth. And if something doesn't feel right with seeing a dentist, go see another one. You want to make sure you feel comfortable, and they should be able to show you things. X-rays aren't that impossible to read. We can show people how to read briefly an X-ray, right? They're not going to be diagnosticians on it or anything, radiologists, but they'll go, oh, I can see this dark area. I can see this. I can see that, right? And we want to help them get infection under control. So dental infection and gum disease infection. So that's through hygienists, et cetera. But then we have to look at, where did it come about? How did it happen? What is their nutritional protocol? And then in a holistic practice, you're going to get more natural products. Now, the difficulty with the natural products, let's say someone comes in and they have a mouthful of tooth decay.
Mm-hmm.
Well, first of all, we can fix that. I mean, we're brilliant at doing that in dentistry. You do a biomimetic dentistry, it's going to fix with minimally invasive preparation, and it's going to last much, much longer and protect the nerve much longer. So you can go to the Academy of Biomimetic Dentistry, aobmd.com, I believe it is. So maybe you can put a list of these at the end of the podcast, but
yeah.
People can research these things and they can find practitioners. Then you just have to see, are they going to be holistic and also practice that? Because there's not a lot that are both, but they'll at least, do some of those things. But so we want to get infection out, both dental and gum disease infection. So you work with your dentist on that. At the same time, you want to go, how did I get all this? Okay, are we eating a lot of carbs, sugar, Coca-Cola, Dr. Pepper? When I practiced in West Texas, I could look at someone, I would see their photo and I go, okay, that person smokes, that person smokes, that one smokes, that one does not smoke. This one, and I'd walk in and see a new patient and I'd say, hello, Bob, how are you? And we'd lay back and I said, no, Bob, is it a Dr. Pepper or Coca-Cola that you like to drink a lot? And they would look at me dumbfounded like a deer in the headlights, like, what? How did you know this?
Yeah.
But their teeth were just rotting away and decaying, right? So acidic drinks are not good. So soda is like the worst, Coca-Cola, etc. As an occasional moment of joy with a meal or something, fine, no problem, right? Also, eating candies and sugars and things like that, all those things would need to come down. And they're good for the body too, because they're just destroying the gut bacteria and flora, and it's basically kidnapping you anyway. It's telling you need sugar. You don't really need sugar, So in the mouth, we have the same thing. We have a certain normal flora or biome in the mouth, and we want to balance that out. So even in my company, Great Oral Health, we have a specific oral probiotic that's chewable, and it's for the ear, nose, and throat. And independent studies show that it decreases ear infections in children by up to 50%, and will maintain that. It will also decrease the bacteria that cause cavities and gum disease. It's just quite amazing. So in medicine and dentistry, we've been cutting it out, burning it out, killing it, etc. But we haven't been bringing back the balance, which is where holistic and functional nutrition comes in to bring about this balance. Now we have probiotics for the gut, but what about for this part of the body? So we have that in place. So ultimately, we want to get those things balanced, and we want to look at nutrition. And I'll also say a lot of people are trying to do the right thing too. So they'll go on a vegan diet. I have no big word to say on this diet or that diet, except if it's got a lot of carbohydrates in it. And if it's a purely vegan diet, they have to make sure they supplement, they get enough protein. And dental wise, they have to supplement with phosphorus and arginine. It's very important. If they don't do that, they'll be susceptible to tooth decay. And so anybody that comes into my practice, they're on a vegan diet, etc. I ask them, well, what are they eating specifically, right? And sometimes they start cheating. They're eating the carbs and the breads and the donuts and the whatever, right? They're not really being pure to the body. But others are very pure, but they'll still get tooth decay. So when they start using the holistic products, you have to make sure that they're good, holistic, natural products. And because if they just use something they got over the internet and they don't know much about it, they could still get a mouthful of tooth decay, and they might go, why is this happening? So it's a combination: nutrition, diet, and then protocols. And when they go on my website, the greatoralhealth.com, and they get the free download, I show how to brush, how to floss. Why? What are we doing with bacteria? We're trying to break them apart, because those bacteria live with us So we want to break them apart, put in the good so that it rebalances, but we can't get rid of all the bacteria, you know? So, I mean, we want to break it apart. It somehow takes them 24 hours to come and form a big enough group that's when they start laying down their acidity and breaking down the tooth structure and causing gum disease. So if we can break it apart with brushing, flossing, and different ingredients that we can use to help, then we get sort of, we're proofed up against the modern Western, what do they call it? The SAD diet, standard American diet. It's so sad, right? Because in other,
it is sad.
Going back, it is, right? Going back to Weston Price, you know, he discovered that it seemed like a lot, these tribes that he discovered, right? So these cultures, they survived quite well. They had almost no dental decay or gum disease problems, but they were eating wild caught meats, wild caught fish, and vegetables. There was very little fruits, because the biggest troubles I have in the practice are when I get patients who are very adamant and they're fruitarians. They eat fruit all day long. It's fine. I don't want to deter that, but if they have to do that, can they at least rinse their mouth out afterwards? And they can floss, but just don't brush right away, because the mouth's too acidic and you'll brush away the enamel that's become a little bit weakened for the first 20 or 30 minutes. So I'm giving a lot of data here,
yes,
rather rapidly, but there's so much that can be done, and it is in that free booklet anybody can get. But you know, want to combine nutrition with getting infection and dental disease under control.
That was so much good information. I think especially the supplementing with phosphorus and arginine for vegan diets, because everyone knows this. I'm not a fan of vegan diets, but again, like if everyone can do what they want. But my bigger issue is that so many people, it's actually much more complicated to get everything you need on a vegan diet. And I think not enough people know how to do that. So, you know, combining the right foods, getting the right amino acids, and now getting this phosphorus and arginine. I hadn't heard of that before. So I think that's going to be super valuable for anyone who does eat that way.
Yeah.
Awesome. Well, we'll put the link, thegreatoralhealth.com, and then people can grab that and they can learn more. And I am checking out your toothpaste over here, and I see that you use hydroxyapatite, which is a great alternative for fluoride. Do you have anything to say about fluoride and hydroxyapatite at all, to just add to that really quick?
Well, fluoride, if you look on the chemistry periodic chart, you know, it's listed where it's listed, and fluorine, fluoride, under fluoride, excuse me. And, you know, it's basically considered a poison. So we know that. And then in the water supply, we get fluoride. It's dumped in from different companies, fertilizer companies, aluminum company, et cetera. They contract with the municipalities and they dump it in. So that's a hydrosilica fluoride. It's not my area of perfect expertise, but what I understand about it is it's not a pharmaceutical grade fluoride that's dumped into our water supplies for the most part. And it's been discovered in 2004, even the American Dental Association said there's no benefit of having fluoride in the water, none. And we still dump it in there. Now, isn't that weird? The science shows there's no benefit. We know there's really no benefit. It can actually weaken the teeth, weaken the bones, and weaken the enamel. It can discolor things. If you go out near West Texas, they had so much fluoride in the water. They had orange, a lot of the kids growing up with orange stripes in their teeth. So that's where I had to learn how to do veneers so proficiently on such young people. It was, you know, it's devastating. They would smile. It looked like not only did they have braces on, but there was holes in their teeth, you know. That's from too much fluoride in the water. Now it's regulated, at least through the larger cities, but when a child has that, and then they put fluoride in the toothpaste, which is in the water, it's 1 part per million. In toothpaste, it's about 300 parts per million. So children, you'll read on any toothpaste that has fluoride, there'll be a little disclaimer below. Go to the emergency room if you think you've swallowed any of this, right? Especially for children, they have to get their stomach pumped. It's toxic. So what does fluoride actually do? Well, it appears to be, because it's a poison or an aggressive type of element, it acts as a it acts as it kills bacteria and bugs because it's such a strong toxin. So it sits there and it's sort of like it'll adhere a little bit to the teeth, so it stays there, and it's a little bit antibacterial for a while. And you would think, well, that's a good thing, but we end up ingesting it, and it goes in the system of the body, etc. And there's a lot of studies on that from the IAOMT as well. But it's basically a pesticide is how it acts in the mouth. And it's sad that we have to do that. And it came from studies in the 40s and 50s, and it's just held on all through dentistry. Like they want to put fluoride in everything. And it appears to be actually beneficial for those people that have just a mouthful of tooth decay and they just want to eat candies and sugars and carbs and not going to change their way. It might slow that down. So in my products, I had to find what are alternative ways so we don't have to put that junk in there. And so it seems to be if you can put enough of the xylitol in toothpaste, which is one of my main ingredients, the xylitol acts as sort of a Trojan horse. It fools the bacteria that want to survive, that cause cavities. And what happens is they'll go in and they'll start eating that pseudo sugar, xylitol, but they can't digest it, and they use all their energy up trying to digest it, and they die. So it causes a slow die-off of the bacteria instead of feeding them like a fire, like gasoline to a fire if you put sugar in there. So it's a fluoride alternative. And there's good independent studies if there's a strong amount of xylitol in the toothpaste, it can decrease the return and incidence of tooth decay. So that's what we're finding. So my position on fluoride is don't use it. Don't put it in the toothpaste. There's no real good reason for it. Definitely don't put it in the water. And that will be validated by the IAOMT. My position reflects their position, and their motto is show me the science. Mm-hmm. So it's all science-based.
I love that. That's awesome. And then the other ingredient, the hydroxyapatite, my understanding is that essentially it's like the same structure or helps build the enamel back up. So that's the protective mechanism with that one, correct?
Yeah, hydroxyapatite, it's just composed of different ingredients that's basically in there, phosphorus and calcium.
Yeah.
And some others. And so what happens is if you crush some bone up and look at it under a microscope, or you identify what's in it, the name they've given to it is hydroxyapatite. The same way with enamel. So it's hydroxyapatite. So if we can flood the area with hydroxyapatite, the tooth in its own way will kind of uptake some of that and help create some healing. And in my product, I have a nano hydroxyapatite and also non-nano. I have both. So the nano, basically the size inside the tooth itself is a structure called dentin, and it's sort of a living, breathing, even though it's an inorganic structure, but it has little tubes in it that communicates and keeps the inside of the tooth hydrated. And by hydrating it, it keeps a certain flexibility. When people eat and chew, it gives a little bit, right? So inside those little tubules, every time the heart beats, solutions flow through those tubules and keep it moistened and take toxins in and out of the tooth every heartbeat, right? So you have that mechanism. But if a person has brushed and they've eroded away some of their enamel and they have a little bit of sensitivity, what happens? Well, if you ever, as a kid, taken a straw, put water in it, you can tap one end and feel it on the other end, right? I don't know if you've ever done that as a kid, but we didn't have all the electronic stuff when I was a kid, right? So we did those science experiments. So anyway, the dentinal tubule on the outside toward the outside of the tooth, if you touch it here, it pushes pressure through their little solution that's in those tubes, and it touches the nerve, and it's like, ow, Ow, that's sensitive. You're hitting a nerve. Wow, that's really sensitive, right? That's
Mhm.
just the water flowing or the solution flowing through there. So with the nanohydroxyapatite, it lays in there when you brush it out with the toothpaste, and it can seed into the opening of that straw or the dental tubule, and it begins to crystallize over. So if you use a macro hydroxyapatite, it's too big for that straw. It's bigger than the whole orifice of the straw. So it might cover, it might not, might slide away, etc. So the nano fits well inside and can actually plug that little hole. And on microscope, scanning electron microscope studies, they show that it actually rebuilds in white crystalline form, which is actually a nice benefit. It can mildly whiten the teeth. It's microscopic, you're not growing 1 or 2 millimeters of new enamel, but if it seeds that, you would think people have less sensitive teeth. And as a matter of fact, about 80% of the time, the sensitivity goes away greatly within 2 weeks. So you know that it's really working.
Wow.
Yeah.
That's amazing.
Yeah.
Very cool.
Naturally. Okay. So it's pretty cool, right?
Yeah. Let's shift a little bit into talking about veneers for a little bit. So
Sure.
what is the difference in all of the different kinds of veneers? We have different prices and types. And how does someone go about getting the best and also maybe like natural and what that means? That was kind of a loaded question.
That's good. Well, a veneer just means a covering, right? So it's like, people would associate a veneer like a countertop could have the old acrylic or formica top that they glued down on top. They call that a veneer countertop, right? This is just a covering. So when we refer to veneers, we're typically talking about something to cover a tooth. Now, why would you want to cover a tooth? Well, it could be twisted, turned, too big, too small, broken, and the color could be awful, and whitening's not going to fix it, those kind of things, right? So then the person said, they look at their teeth and they go, wow, these 4 teeth are so ugly. I've hated them all my life. Grandma finally gave me some extra money for Christmas. I want to go fix my teeth, right? And so they run down to any dentist and they go, I want some, what do they call veneers here? And the dentist says, depending on his skill set, he says, yeah, no problem. I can do those veneers. So some dentists are going to do the veneer by heavily grinding down the front and the top of the tooth. And they might do it very heavily, or some may say, well, it'd be better if you had it wrapping all the way around, which is a crown. Now they're going to grind down 80 to 90% of the enamel of that tooth, thereby weakening the tooth, which would be great if you're 75 or 80 years old. It'd probably be just fine. But when you're younger and we live longer, if that breaks or fails, how much tooth is left there to rebuild? But in traditional dentistry, it's like, oh, well, you broke your tooth. No big deal. I guess it got weak. That's no big deal. We'll pull that and put a dental implant in there. No big deal, right? It's a lot of money and a lot of trauma. And the aesthetics are a challenge to get it to really look natural again when you're pulling teeth. How do we prevent it? Well, less of a preparation. So that has to come with photography and planning. Are the teeth going to be shifting, not shifting? What's the stability of the bite? All those kind of things. So you have to really do your research and look out there, look at before and after photos, and then ask the dentist, how much do you take off the tooth? A very important question, because now we can take off. So our fingernail is about maybe 4/10 to half a millimeter thick. We can take off about a half of that and create a beautiful veneer over the outside of a tooth. And thereby we're doing minimally invasive preparation. And if they ever chipped or broke one of those veneers in the future and we have to replace it, 90 to 95% of the tooth structure is still there. So we haven't caused great harm. So we've done very little destruction to create this beautiful result. Now, the reason a lot of dentists don't do that, they weren't trained to do that. And number 2, their lab wants a lot of space so they can make something look pretty. It's easy for them. So when you do an ultra thin, minimally invasive veneer, you have to prepare it properly, and the technician has to be specially trained in it. And then stronger materials need to be made, because if you do traditional materials, they can chip more readily. So there's a little bit of science behind it. And I like, people that are listening out there and watching the show, really do your own research and look at things, because you'll see some dentists are, I call them heavy-handed. They grind a lot. So the teeth, people watching go, yeah, my tooth looked like a cat tooth after they were done preparing it for a veneer or a crown or something. And there's no need to have to take that much away. We just don't have to do it anymore. We can barely remove anything and then place something over it. It looks gorgeous. I mean, if people even go on my website, it's not even to say, come see me or anything like that, right? It's just, you can look and see, just go to drpaulo'Malley.com. And I have a lot of photos up there that shows minimally invasive dentistry, not only the back teeth, but also in the front and what can be done. And there's a freeholisticdentalcourse.com is another website they can go to. I put together a free course, anybody that wants to watch it. And I show the difference between an aggressive preparation or a minimally invasive preparation. And people can see with their own eyes and go, wow, I'd much rather have that one, right? I say it jokingly, like it's on a front tooth. So I grind down this one front tooth and it's like, looks like a little peg tooth, like a cat tooth. And the other one I do very minimally invasive. And I say, which one would you rather have? Right? It's a no-brainer.
Yeah.
But that's what people don't know when they go to the dentist, and they should ask those questions. How much do you take off? How much will you leave there? And if they do that, they'll feel better about their choice, and then make sure they're getting someone that has aesthetic and cosmetic skill, because it's a very exciting time for people. I mean, you fix someone's whole mouth. You have someone that doesn't smile literally. When they smile like this, or men will come in with the mustache that hangs down over their lower lip. So when they smile, you can't see their teeth, right? And the minute you fix their teeth, the next time you see them, the mustache is either gone or it's trimmed. The women that had some atrophy in their smile, literally, I'm helping someone right now, she couldn't hardly smile. She wouldn't lift her lip. So it atrophied, the muscle did. Now it's coming all the way up. She's showing all of her teeth, right? I mean, so for us as practitioners, we love that. But now knowing I barely touched her teeth at the same time is really rewarding.
That is super cool. That is very cool. Is there anything that people need to know about making that cosmetic work actually last longer? Is there anything different they do after they get that work done?
Well, after they get the work done, it depends how much they get done. But if they're doing like their whole mouth, almost always I make what's called a night guard to protect the teeth. So at nighttime is where a lot of the damage goes. People rub their teeth. They might bang something or hurt it in the middle of the night, and they begin to create little cracks or weaken things. But two things. One is I want to make sure the materials are compatible to their body. So you want to get BPA-free materials, BPA-free adhesives, those types of things that don't leak out into the system, et cetera. And then if the procedure is done very well, if it's minimally invasive, it leaves more enamel on the tooth. If it leaves more enamel on the tooth, it keeps the strength there. And then when you bond it to the tooth, it has a greater bond strength, typically. So they're not going to pop off. They don't come off. And so it's really good. So then all they have to do is brush them and floss them and do the GOH system, the Great Oral Health System. If they do that, they'll probably have them for 20, 30 years or more. And honestly, after 35 years or so of doing veneers, I haven't had to replace a whole set in this time. Not to say that someone might have moved and they had something redone here or there, but they just last and they're so beautiful. And even if the gums over time recede just slightly, you don't even see the edges like you do with old crowns. You've ever seen people, they smile, you see the black up near their gum line? That's because they had crowns with metal under them and they leak and they cause that. With these new minimally invasive and super aesthetic veneers, you just don't see that edge It just blends seamlessly into the tooth. So you just brush, you floss, because they look, act, and feel just like natural teeth again.
Amazing.
Yeah.
Couple more questions really quick. Can you
Sure.
tell us a little bit more about the importance of the bite of someone's mouth?
Yeah.
Is that a big question?
It's a big question, but
Oh
let's see,
boy.
how do I simplify it? Okay, so Mother Nature created our jaw and our bites to come together in a really cool way, that when we clench together, we feel the muscle on the side. Like, you can even do it now. Just put your finger right on the side of your cheeks, and when you clench, you feel it pop out.
Mm-hmm.
Right? Now, if you slide to your front teeth, try to clench, and what do you notice?
Am I moving my teeth forward, my bottom teeth?
Yeah, move your bottom teeth forward, and then try to clench like that. What do you notice?
My jaw doesn't pop out.
That's right.
I can't close. Yeah, can't close it all the
So
way.
Mother Nature made it so when we slide forward on the front teeth, it shuts down those big crushing muscles.
Mm-hmm.
Okay. Now, anybody can check this themselves. They put their finger there, clench, feel it, and then when they slide a little bit forward, if they clench and those muscles are still active, then what's happened is they probably, not always, but probably have flattened their teeth in the front enough to where they're able to crush, whether they're on their front teeth or back teeth, and they'll cause severe grinding wear of their teeth.
Oh, wow.
That's a self-diagnostic tool, and then they can have the dentist further evaluate that, right? So what do we do in a situation like that? Someone that's grinding, wearing their teeth. Well, if there's no other infection, nothing else there, and they've done minimal harm, we make a night guard and then let them clench to their, heart's happiness. And, sometimes they say, well, I wear through my night guard, and I'm like, good. I'd much rather you wear through your night guard than your teeth. So if you have to make one every 3 years or something, fine, it's worth the investment. $600 versus fixing one tooth for $2,000.
Yeah.
It's a no-brainer, right?
Yeah,
So,
exactly.
so that's what can happen with the bite. And a good majority of people do what we call bruxism. Bruxism means night grinding. So they're trying to find a position to get their teeth comfortable in, and they just can't shut that motor activity off. Some do it more than others, but they can see. You have to look and see if there's wear on the front of the teeth. Look in the back and see if the chewing surfaces are flattening or dishing out. And you'll be able to see, oh yeah, because a lot of people, it happens so slow, they think it's normal, but it's not. Normal wear and tear is there's going to be a little bit, but not much. So if a person doesn't have the grinding habit, they'll have their teeth for a lifetime, as long as they don't have gum disease and decay that takes their teeth away, and they won't have this wear pattern. But here's the other caveat with night grinding. If a person sees they've flattened their teeth, they're wearing their teeth, or they've done this exercise and they say, uh-oh, I'm clenching in both areas, but they see the wear in their teeth and it's fairly significant, they're about 50% prone to having sleep apnea. So if they have sleep apnea, that means basically their breathing shuts off in the middle of the night while they're sleeping. They'll snore a lot, and then they'll stop snoring. They'll stop breathing, sometimes up to a minute, and then they'll gasp for air, and then they'll go again. So there's a lot of theories on this stuff, but it's a telltale sign. You have worn teeth, check with your dentist, and you should probably do a sleep study, because if you have sleep apnea, you imagine, what if you had sleep apnea and gum disease? Sleep apnea puts a person majorly at risk for cardiovascular disease, heart attack and stroke, middle of the night, because they're not catching their breath, etc. And then if you have gum disease, you've got that too. Now you have a perfect storm to have a cardiovascular event that could be fatal. Well, it can be prevented by seeing these telltale signs. And that's where the whole body connection comes in with holistic dentists. We see it and we go, okay, good, you should get a sleep study. Now the patient knows, I should get a sleep study. And then we try to correct some things with a night guard, etc. But people can self-diagnose a little bit. Go see the dentist, have that evaluated, make sure if you're grinding, there's no sleep apnea. If there is sleep apnea, then that's another show, and I'd probably get another expert on with you, because there's ways to treat it with special night guards that brings the jaw forward, that opens the airway. There's also other ways to treat it before a person has to go on the CPAP oxygen sort of generating machines and things like that to help them breathe. I hope that answered
That was
your
great.
question somewhat. Yeah.
That was great.
Oh,
I know.
by the way, so when people are doing dentistry, they just want to make sure, like a person can get a back tooth fixed, a filling done, or something that lays on the tooth to restore it, and then they leave, and then next day it feels a little high. Well, it's not abnormal for that to occur, because when they're having work done, they're numb, and the dentist uses paper to check things to make sure it's just right. And we do the best we can, but sometimes the patient's perception is better than what we can see with the paper. So a person goes home and goes, wow, I can't believe it. My tooth is high now. Well, what's up with that dentist, right? And it's like, no, it's really hard we're talking about 1/100th of a millimeter can be off, and it'll feel like a rock in the mouth, because the mouth exaggerates sense of feeling and sensation 200 times more than our fingers. That's why little babies put everything in their mouth. They can taste it and feel it way better than their fingers. So 200 times more. Anyway, so in a situation like that, it's not abnormal. Just call a dentist, go back in. Now you're not numb, and a little adjustment. Boom, boom, boom. Oh, that feels great. Thank you so much, right? That's for a single tooth. If you're doing a full mouth, you just want to make sure that the dentist understands bites and knows how to manipulate and move bites in the right position. Because if they're in the right position with the jaw joint, there'll be no discomfort back in the jaw joint. The mouth will close and feel comfortable. And sometimes it even helps with the airway.
That's super helpful. Well, I know we have to wrap up here. One more quick rapid question that I ask everybody. And just first thing that comes to your mind, don't think about it too hard. If you could leave the listeners with one tip that they could implement this week that would help them live a healthier, happier life, what would you tell them to do?
Make sure your teeth and gums are super healthy. Don't be afraid. Go get it checked and evaluated. Just make sure they're really healthy. It goes a long way. And remember, only floss the teeth you want to keep.
Okay. That's a good one.
That's my tip.
I'm going to start using that.
That's right.
Okay. Well, I'm going to put all your links, your website, your social media, all the free courses and resources you were talking about, which is amazing that people can get. Those will all be in the show notes. And this was an awesome conversation. So thank you so much for being on the show.
My pleasure. Keep doing what you're doing, and send me more of your information, etc., because I have people from out there, and we can liaise.
That sounds great. Thank you.
Thank you, Rachel.
Thanks for watching the episode. I really hope you enjoyed it. And if you did, make sure that you like the video and leave a comment and share it with a friend who really needs to hear it. Because when you share this information, you're also going to help other people level up their health. And if you or somebody else you know wants to work on their health and they're looking for a functional medicine practitioner, feel free to reach out to me to apply to work together. Thanks for watching, and keep striving to become your healthiest, happiest self.